I will start off with a special thanks to our series sponsor, Sandata. Sal Sparacino, Sandata's Vice President of Provider Sales, is here to share a little information about them. So Sal, take it away.
Great. Thanks, Kathy. Appreciate it. You can hear me?
I can.
Okay, good. A lot of times you end up putting yourself on mute and you never take yourself off. So as Kathy said, Sal Sparacino, Vice President of Sales for the certain regions, the East Coast, West Coast. I mean, I'm all over the place, but I've been dealing with the Arizona Association for a long time now. Thank you very much for allowing me to have a couple of minutes to speak. So as Kathy had mentioned, I am with Sandata Technologies. You've probably heard of us because we are the product that the state has chosen for EVV. So I just wanted to go through a little bit about who Sandata is and some of the products that we offer. The products that are being offered by the state are what the state is offering in their system, but we do have other products that are also available. So just to let you know about Sandata, we've been in business for over 40 years. We have experience with the 15 different state Medicaid agencies and 8 MCOs. We are currently the only EVV solution with CMS certification, and we are probably the only vendor at this point right now that is got experience in all 4 EVV state models. We have an EVV solution that we started with back over 40 years ago, so it is one of the core products of what we do. We have 250 employees that are just dedicated to the home care market itself. We do over 150 million transactions a year with our systems. We have 90+ integration points within third-party systems, and we manage over 1.3 million clients. So our daily reach is about 400,000 homes is what we do. Oh, sorry. The core products that we have, the first one that you're probably aware of is the EVV solution, which is the call-in and the call-out. We also have a Sandata agency management product, which is our back-end system, which is the referral to cash that does both Medicaid, Medicare, and in private duty and facility staffing also. We've also got a mobile app that is connected within the Sandata agency management system that allows you to do your clock in and your clock out with a cell phone. So whether it be an Android device or it be an iOS device, you have the capability of being able to see your visits within it and do your clock in and your clock out. We also have a point of care product, which is does your different forms, your standard forms, your Briggs, your MedPass, customized forms that we can also do if you're doing any of the Medicare business that you've got. We also have a payroll solution where you can also run your payroll through our system to produce your payroll checks for your staff. The mobile app itself has about 27 different languages that we have, and it also works in connected and disconnected mode. And as I said, it works with either the Android or the Apple device. It also works off of GPS so that when you're clocking in for your visit, it works off of the GPS notification to allow you works that way. If you don't have access to a cell phone, then you can use the client's phone to do your clock in and your clock out. You would just need to put in your user ID and password into the phone, and it'll collect the same information. And we use the location of the phone to be able to track where it's coming in from. If neither one of those are available, we also have a separate device, which is a fixed visit verification device. It's a little device that gets affixed into the patient's home. It just generates a six-digit number that allows you to be able to clock in and clock out doing that. One of the other things that we also have within our system that's integrated into it is the ability to be able to fill open shifts, so that if you have a large number of clients that are the caregivers call off, they either call in sick or go on vacation, and you need to be able to fill those shifts quickly, we have an application that's built into the system that enables you to be able to find your caregivers that are the closest match for those clients to be able to to send them a notification to let them know that there is an open shift. You can send it to one of your caregivers. You can send it to multiple caregivers. It gives you the capability, then they'll be able to say whether or not they're available for it. And then you can just change it and it automatically goes out and updates the system for you. So you don't have to go back into the system to update your schedules and go that end. That's a little bit about SanData. If anybody has any other questions or anything that I can do to help out, even if any concerns about the state mandate, I'm more than happy to answer any questions that you may have. At the end of the presentation, I think that you'll have my contact information, and you'd be more than happy to reach out to me either by phone or by email. And if you want, I can also put it into the chat if you don't have it, Kathy. Thank you very much for your time, and everybody have a great day and enjoy the session.
Thank you, Sal. There will be a short Q&A at the end of the presentation, and then we also have the chat that you guys are welcome to write any questions, and those will be answered. All right, so our presenter today is Mr. Stephen Tweed, Chairman and CEO of Leading Home Care, a Tweed Jeffries company. Mr. Stephen Tweed also authored books on the industry and is a well-known speaker across the country. For this session today, Mr. Tweed will be talking about recruiting during the COVID pandemic. And Mr. Stephen, I'll turn it to you.
Well, thank you, Kathy. Appreciate the introduction. It's great to be back with AZNHA. As many of you know, I've spent a couple of Januaries in the Phoenix area and was able to speak with your group and attend some of your events in person. And so when Dana reached out and asked me if I would come to you virtually, I'm delighted to do that. So I bring you warm greetings from the sunny suburbs of Louisville, Kentucky. And today we're going to shift gears just a little bit and share with you some strategies and insights for dealing with the changes that are taking place in home care. And so my title for today is Home Care 2021, 6 Seismic Shifts that are shaping the future of home care in a post-COVID world. And one of those seismic shifts, of course, is the caregiver recruiting and retention crisis, and we're going to dig into that. To begin with, I want to take you on a little journey, and the journey begins in June of 1993 in Hawaii on the island of Maui. My wife, Elizabeth, and I are business partners, and we work together, but mostly we work separately. And one of the fundamental principles of our company is that whenever possible, we mix work and play. And so on this particular day, a Tuesday, as I recall, Elizabeth was working and I was playing, and I thought that was a good mix. Elizabeth was doing a customer service workshop for the Westin Hotel on Kaanapali Beach. And so I went off to the airport and took the tourist helicopter ride around the island of Maui. And it was an amazing experience as we looked at the big picture of the island and then zoomed down close to look at waterfalls and beaches and take in the amazing scenery of the island. And so today, I want to take you on a little bit of a helicopter ride up above the day-to-day busyness of running your home care company and look at what's happening in our industry and give you some thoughts about thinking strategically about how to grow your business and get ready for the future. Now, this is a model of strategic thinking that I have been using for many years now. And it's a way for us to think about how to grow your business into the business that you would like to have. And so I always start over here on the left with now. Where is your business today? And of course, today it's probably different than it was in January. And the crazy COVID crisis has made some big changes in our home care company. And so we always take a look at the current reality of your home care business, what I call a strategic profile, a snapshot of your business as it exists today. So we always start with where we are today. And then we look to the future, and the future of your company is influenced by a number of things. First of all, we have some forces and we have some trends. Forces are those pressures that cause change, and trends are the patterns of change that happen. And today we're going to be looking at some of the forces and trends that are shaping the future of your business. your business is also influenced by your desired future, what it is that you want your business to look like. And let's say 5 years from now. And so we start with vision. Do you have a clear picture of your home care business 5 years from now? We look at the culture. Culture is simply the way that we do things around here, and culture is influenced by the leadership style of the CEO, the values that guide your decisions and actions, the behavior you expect, and of course the behavior that you permit. And then the strategy. What is the strategy of your business to reach out into the local marketplace, to attract new clients, to attract new caregivers? And all of this rests on a foundation here of competitive advantage. What is it that makes your business different from the other 8,000 home care companies in the Valley of the Sun? Well, maybe not quite 8,000. It just seems that way on some days. And then what moves us from where we are now toward the future is, first of all, leadership. That's y'all. The actions that you take and the decisions that you make influence where your business is and how it will move from where you are now to where you want to be in the future. The second thing that drives you toward the future is focus. It's the ability to concentrate your energy and your effort and your activity on those few things that make the most difference. And then finally, it's action. It's what are we going to do as a result of all of this to grow your business? I remember doing a seminar in California a number of years ago, and we were talking about this, and we were talking about vision and culture and strategy. And I remember a young woman stood up in the middle of the group and she said, remember, vision without action is hallucination. And we all laughed and chuckled, and I've used that line many times. Vision without action is hallucination. And then at another program later, somebody stood up and said, well, that's true, but also action without vision is confusion and chaos. And so what we want to have is a vision of the future and focused action to take from where we are now to where we want to be. So this is the model of strategic thinking that we've been using. And based on this, we want to take a look at those forces and trends, the outside pressures that cause change and the patterns of change that are caused by the forces. And as we look at these outside forces, there are really 5 specific areas that I've been following for many, many years in the home care industry. First, we have economic pressures. Next, demographic changes. The third is consumer choice. The fourth is technology. Sal talked to us about EVV and technology. And finally, political change. And I think you recognize that all of those things are going on right now in our world. And so what's the impact of these 5 forces? Well, what I've been following is what I call the 6 seismic shifts that are shaping 2021 and beyond. We're going to spend a little bit of time talking about each of these 6. The first, of course, the crazy COVID crisis and what that means and the impact that it is having on home care. The Medicare Advantage program and in-home care and what that means. We'll be talking a little bit about private equity and industry consolidation, and that leads directly into increasing competition. Number 5 is the caregiver recruiting and retention crisis, and number 6 is data-oriented decision-making. So let's jump right in and talk about the crazy COVID crisis, and more specifically, the long-term and short-term impact of COVID in home care. Back in April, Vicki Hoke, who's the new executive director of the Home Care Association of America, called and asked if I would be willing to facilitate a series of web conferences talking about home care companies caring for clients with COVID, and would I tap into our home care CEO mastermind groups. As some of you know, part of what I do at Leading Home Care is run the Home Care CEO Forum, and this is a network of owners of independent home care companies. And in 2012, we organized a series of mastermind groups. And these are groups of companies and owners that come together twice a year face-to-face and once a month by video conference to share ideas, to solve problems, and to support one another. And actually, we have several of our mastermind members from Arizona on the call today, so welcome. And so what we did was we reached out to some of the members of our top 5% group and our top 7% group to get their insights into how they were dealing with the COVID crisis. And coming out of that, we identified some short-term impacts on home care agencies. So for example, one of the impacts we saw, which was positive, we saw a lot more interagency collaboration in various markets. I know in the St. Louis market, we have 3 different companies that are part of different mastermind groups, and they talked about how they were getting together with small groups of companies to support one another. That led to the procurement of personal protective equipment and training caregivers and other staff in the use of PPE. And so the interagency collaboration to acquire personal protective equipment. Another short-term impact was business uncertainty. People had no idea what was going to happen to their business, and some saw significant declines in revenue during the first couple of weeks, and then they rebounded and came back. Others saw a little decline, and then they rebounded to back where they were in January. Other companies have seen significant business decline beginning in March and continuing to today. So still a fair amount of business uncertainty. The other big uncertainty was legal liability. People weren't concerned about whether or not they would be sued by clients, for example, if a caregiver came in and exposed them to COVID, or being sued by caregivers who were exposed to COVID by a client. And so there was a great deal of question and uncertainty, and to some extent fear on the part of company owners. And of course, we saw the reduced revenue and increased cost of providing care during COVID, and this had an impact on gross margins and on the bottom line for many home care companies. As we have continued this, we look at the long-term impact of COVID, and there are a couple of things that are coming out of this. One is home care's role in the healthcare continuum, and we're seeing, as a result of the various COVID relief acts from Congress, that home care has become a more visible part of the healthcare continuum. And in fact, as part of the FFCRA, home care was designated as an essential part of the healthcare continuum, and home care workers were exempt from the requirements of that law. Subsequent to that, the state of New York sued CMS about that, and the court ruled in favor of the state of New York, and so that exemption has gone away. But I think the early impact was that home care is now seen as an important part of the healthcare continuum. The other thing we're seeing is a demand for higher skilled, more complex care, and particularly as home care companies prepared to care for clients with COVID, they geared up their personal protective equipment, they geared up their training, they geared up their testing for COVID, the screening of caregivers prior to a shift. And so we see more and more home care companies that have developed a higher level of competency and skill, and that is being recognized by others in the healthcare continuum. We also saw the advance of telehealth and data collection and technology in home care. And Sal was talking about EVV and the requirements in Arizona, but we're seeing other impacts of technology. We're seeing more companies looking at client monitoring and other data technology. And in a moment, we'll be talking about data-driven decision-making. And of course, another long-term impact of COVID has been the overall impact on caregiver recruiting and retention. Before we started the formal part of the program, we talked about unemployment compensation and the impact that that has had on your agencies as you try to recruit caregivers. We've also seen some impact on turnover, and we'll talk about that more going forward. And so as we look at all of this, we realize that there are opportunities and there are threats for home care leaders coming out of the COVID crisis. We see opportunities including increased knowledge and ability, an improvement of public image and perception among the public and the healthcare continuum. Referral sources are more aware of us. Some companies are gaining competitive advantage through their willingness to care for clients with COVID. We see companies improving their systems and procedures so that employees could work remotely. Some companies have seen significant revenue growth coming out of COVID, and we've seen some cost reductions in some cases. So there are some interesting opportunities being created by the COVID crisis. There are also some threats. One is the unknown unknowns. We just don't know what we don't know about COVID. There's the legal liability threat that continues. We see this issue of revenue versus profitability. And of course, caregiver retention remains a significant threat going forward. So being aware of that, we as leaders look at the pros and cons of caring for COVID-19 clients and the impact that that has had on our business, on our caregivers, and on client families. So the COVID crisis has been a huge issue. The second big seismic shift shaping our future is all the buzz coming out of 19 about home care services under Medicare Advantage. And there was lots of buzz, and the buzz has sort of slowed down a little bit during COVID, but I had a question just today from one of my mastermind members about the impact on Medicare Advantage. As a quick update, in April of 2018, the organization that manages Medicare Advantage and contract administration sent a note to the industry introducing the opportunity for Medicare Advantage plans to offer a group of supportive benefits. If you're not familiar with Medicare Advantage is the private insurance model to provide Medicare for people over the age of 65, and the percentage of Medicare beneficiaries and the number of Medicare beneficiaries enrolled in Medicare Advantage plans has been growing dramatically over the past decade. We also see the increase in the percentage of Medicare Advantage beneficiaries as a percent of the total Medicare population and the percentage of Medicare beneficiaries taking part in traditional Medicare. As we look at that, the number of Medicare Advantage plans has grown increasingly to about 3,100, almost 3,200 plans in 2020, and 32% of Medicare beneficiaries were in a Medicare Advantage plan in 2017. What's interesting is that 7 Medicare Advantage plans out of that 3,148 control 75% of the market, and 3 plans, United Healthcare, Humana, and Blue Cross Blue Shield, serve half of the Medicare Advantage members. And that's a significant thing for you to be aware of if you're thinking about the impact that this will on you and your agency. In the April 2018 memo, there were 9 specific supplemental benefits that were offered that Medicare Advantage plans could offer. One of them, number 3 on this list, is in-home support and services. And so while the trade press in the home care industry made a big deal about home care being offered through Medicare Advantage, it's one of 9 different services. The in-home support and services definition in the law is shown here on the screen. I'm not going to read it to you. You'll be able to read it, and we will share with you a copy of this slide deck so that you can have this for future reference. The rule change came as part of the Chronic Care Act and the Bipartisan Budget Act in 2018. And at that time, Medicare Advantage was covering 58 million people enrolled in Medicare. So what's the impact of all of this on home care? Well, it really raised 4 key questions that if you're interested in looking at Medicare Advantage, you need to be thinking about. The first question is, will Medicare Advantage MCOs implement this option? They are not required to do it, and they will not receive any more money if they offer in-home care as an option. The decision to add in-home support to a Medicare Advantage plan is really based on sales potential, not cost savings. Will the plan be able to increase the number of beneficiaries who are enrolled in the plan? And this is a really important message that came to me from a senior executive at one of the top 3 plans who said, the reason that we would offer in-home support is because it would attract additional enrollment into our plan, not because it would save cost and keep people out of the hospital. And I think that's one of the important things for home care to realize is while we talk about how home care can save costs for a Medicare Advantage plan, that's not their focus. Their focus is on selling new enrollees. And so this was a great question that was asked to me by an executive of one of the top 3 plans. Do beneficiaries in a local market want this service, and will they join a Medicare Advantage plan to get it? Does that 85-year-old lady living street want in-home care as part of her Medicare plan, and will she join a specific plan in order to get that benefit? The trade press has spun this into more than it is. In 2019, every player was dipping their toe curiously into the pool. And this is a direct quote from that executive at one of the top 3 Medicare Advantage plans. So what does all this mean? Well, in 2019, only 3.4% of the 3,700 plans actually offered in-home support. So that was 126 plans. And remember that a plan is a local market. So Humana, for example, may have 100 different plans in different local markets, and only 126 plans were offering in-home support and services. It's very interesting that the trade press changed their way of describing it in 2020 because there's no information that I could find to tell exactly how many plans were offering in-home care in 2020. This graph came out showing that other supplemental supports and services are growing at a much faster rate between 2018 and 2020 than in-home support. In-home support's the bottom blue line on this list. The top lighter blue line is comprehensive dental care. The green line is over-the-counter drugs and other over-the-counter benefits, meal plans, transportation services, and last on this list is in-home support and services. So I think what this suggests is that this notion of Medicare Advantage being a huge revenue opportunity for home care has not turned out to what we expect it to be. The second question is, will Medicare Advantage MCOs require their providers to be Medicare certified home health agencies? And we have seen a few examples of that, but we don't know. So if you're not a Medicare certified home health agency, it may be that plans won't contract with you. The third question is, if MCOs allow non-Medicare agencies, how will they select a provider? And in the last couple of weeks, I've talked to several providers that do have agreements. In one case, the provider covers the whole state of Tennessee. In another case, this provider covers the whole state of California. And a third example is a provider that has offices in, I think, 38 states. So if you have a local office in the Phoenix metro area, what's the likelihood that you will be selected when they're choosing other companies that can cover a wide geographic area? The fourth question is, how will MCOs authorize hours of care and what rates will they pay? We have very little data on this. The first data I saw was an offer from Anthem Blue Cross and Blue Shield in the southeastern part of the United States, and they were offering 124 hours of care per year, not per month or per week, but per year at a rate of $16 an hour. Well, obviously that economic doesn't work for anyone. I was talking with a member of our group today that said he heard in his local market in Ohio that a plan was offering $28 an hour for 40 hours a week. However, he didn't have any data as to whether there was actually any clients receiving this amount of care at that rate. So it's still pretty much an unknown quantity. So my prediction is that we need to pay attention to Medicare Advantage, but at the current moment, there's not a lot of opportunity out there. So I would suggest staying in touch with this, but putting your focus on generating revenue through your private pay business, or focusing, if you are working with Medicaid, to provide exceptional service and earn the right to serve those Medicaid patients or those private pay patients. We're going to take a quick pause. We've been in this a few minutes to take a few questions. And the way to ask any questions is to open up the chat box and type your questions into the chat box. And Dana is with us as our producer this afternoon, or this morning in your case. And Dana is going to read any questions that come into the chat box. So if you have a question, go ahead and type it into the chat box. And I will stop sharing my screen. And Dana, do we have any questions in the chat?
Stephen, I actually have a question on that Medicare data. Do you have any specific data for here in Arizona about how the pilot program went here?
I do not. That's a good question, Dana. Thank you for asking. And it's been very difficult to get information on specific Medicare Advantage plans in specific markets. I've been doing a fair amount of digging and so far have not seen much data at all about Medicare Advantage plans offering in-home support services in the year 2020. Other questions in the chat box?
Does anybody have any questions?
Okay, well, if not, we'll keep on going, and then we will pause at the end for an ongoing Q&A session where you can ask as many questions as you want, and we'll stay on as long as you have questions. The third seismic shift that we've been watching is private equity and industry consolidation. What we're seeing is private equity and venture capital groups investing in the home care marketplace. And I think that's going to have a significant impact on you and your company. First, we see software companies consolidating. Many of you probably use ClearCare, and ClearCare was actually started a number of years ago with some outside venture capital. ClearCare went on then to acquire HomeTrack, and those of you who have been around the industry a long time remember that HomeTrack was one of the early pioneers in scheduling software. They were acquired by ClearCare a couple of years ago, and then ClearCare was acquired by a company called WellSky. WellSky is accumulating software companies all across the post-care continuum. And so earlier, ADLware, some of you may remember ADLware, was acquired by Kinzer, which was a software company serving the home healthcare sector, and Kinzer was also acquired by WellSky. So now we have two different home care software companies owned by WellSky. Syneto was a prominent software company in the private pay space. It was acquired a number of years ago by Matrix Care, and then Matrix Care has been acquired by ResMed, which is actually a medical device manufacturer. They're probably best known for their CPAP machines. If you're familiar with cardiopulmonary and sleep disorders, ResMed is a big manufacturer of CPAP machines. AppointMate was a freestanding software company that was acquired about a decade ago by Delta Health Technologies and has since pretty much evaporated from the scene. And AlayaCare, an emerging software company in Canada, announced that it has taken some capital from Innovia Capital in Quebec, France. And so we see software companies being acquired by venture capital. And I don't know what your experiencing is, but my experience is that when a software company gets acquired, they often change in terms of the product, the functionality, and their customer service and support. We also are seeing consolidation among independent agencies. Here are 4 examples. NovaLeap, a company in Halifax, Nova Scotia, has been buying home care companies in Massachusetts, Vermont, New Hampshire, Rhode Island, and then they did a jump to Oklahoma. Briggs Corporation, a Chicago-based healthcare company that was very big in paper forms for hospitals and skilled nursing facilities and home health agencies, realized that the paper forms business was going away. And so they have acquired at least 10, and actually that number is now up to 14 independent home care companies in the Midwest. Family Resource Home Care in Liberty Lake, Washington has merged with an equal size company in Seattle to create about $20 million company, and they have continued to grow by acquiring other smaller independent agencies in Washington and Idaho. And Arosa Live Home is a company that is combined, a company in North Carolina and a company in Texas. They have acquired 2 geriatric care management companies in Tennessee and Illinois. So independent home care companies are consolidating, and we're going to see bigger and bigger competitors in your local market, and the venture capital companies are playing a big role in that. We also see many of the top 10 franchisors being acquired by private equity funds. Comfort Keepers was acquired by 2 different private equity companies, and then they were sold to Sodexo, which is a large food service corporation, in 2009. Griswold Home Care was acquired by a venture capital company in 2012. Home Helpers was acquired in 2016. Right at Home and parent company RiseMark Brands were acquired by investors in 2016. Senior Helpers was acquired, and most recently Interim Healthcare. So most of the top 10 franchisors in the market have either been acquired or have taken investment capital from venture capitalists. And also, you may have followed this, that Humana, the large Medicare Advantage insurance company that we were just talking about, is now the largest provider of in-home care. Several years ago, they acquired Senior Bridge, which was a large private pay home care company and care management company. They then partnered with a private equity firm to acquire Kindred at Home, the largest home health agency in the country. They then acquired Curo Health, the country's largest hospice organization, and they recently partnered with a private equity firm to acquire Partners in Primary Care, a company that sends primary care physicians into the home. And so the largest provider of in-home care in America is the 3rd largest insurance company in the country. And so that leads to a conversation around increasing competition. And we see, certainly in your local market in Phoenix and Tucson, you have huge increases in competition, both from independents and franchises. We also see competition from what we call the affiliated companies. That is, private pay home care companies affiliated with a senior living community or a hospital system. And I know you have a number of those in the Valley of the Sun. We've been tracking this, and we often get the question, how many home care companies are there out there? And the answer is, we don't know for sure, because there are only 29 states that actually license private pay home care. There are still 21 states that have no licensure, but based on looking at licensure data, looking at franchise data, we believe that there are about 26,000 companies doing what you do. They are not all in the Phoenix market. It just seems like that on some days, but we believe there are about 14,000 independent home care companies. In September of 2019, we updated our franchise list. There are 62 companies selling franchises, and last September they had 6,939 franchise locations. And we believe there are about 5,000 affiliated home care companies across the country. And so we look at these major trends, and what we're seeing is, and again, no surprise to you, most metro markets are saturated with home care companies. We're in the early stages of industry consolidation, and there was a significant trend of home health agencies and senior living communities getting into private pay home care. However, we've seen that trend reversing as both home health and senior living find it very difficult to run an effective home care company. And so many of them that got into private pay home care are now getting out, or they have sort of put their home care businesses on the back burner. That leads us to trend number 5, and the one that you're all wanting to talk about, which is the caregiver recruiting and retention crisis. And many of you know that I wrote a book back in 2017 called Conquering the Crisis. And this was a look at the crisis, the solution, and the systems for dealing with caregiver recruiting and retention. I hope that you're all followers of Home Care Pulse and the annual Home Care Benchmarking Study. The 2020 study just came out a few weeks ago, and we see that the trend of turnover has created a little hook in it. From 2009 to 2017, there was this steady upward trend to 66.7% of caregivers turning over, then a hockey stick up in 2018 to 81.6% turnover. And the good news is that turnover number has come back down in 2019 to 64.3%. However, when 64% of your caregivers turn over every year, that's a huge burden on your company and on the industry. And again, we were talking about the biggest challenge being finding caregivers. And so we continue to do this research, and we start with recruiting, and recruiting is all about putting as many high quality applicants into the top of this funnel as possible, and then having various layers of filter that spin out applicants that don't meet your criteria, and having a steady stream of high quality hires coming out the bottom of the funnel. In today's market, the challenge is filling the funnel with high quality applicants. And we continue to do research on what's working and what's not. And what we've seen is that in many instances, home care companies have focused almost exclusively on online digital recruiting. And yet our research shows that to be successful in recruiting in the short term and the long term, you will need to develop what we're calling a 3-pronged recruiting campaign. The first prong is referral programs, specifically employee referral programs and client and family referral programs. And we're seeing lots of data from our research and study that shows that the best place to find high quality candidates is through an employee referral program. And so we are continuing to do research, and we'll be introducing some new information in the coming weeks and months about how to build an effective employee referral program. You can also reach out to your clients and their family members for referrals to applicants for your caregiver jobs. And so we'll dig more deeply into this as we go forward. The second prong of the 3-pronged recruiting strategy is digital recruiting, and it starts with your website. And I'm shocked at how many companies have not really stepped back to look at their own website and to ask the question, if I were a caregiver working today in Phoenix, Arizona, and I looked at your website, does your website tell me a story about a place that I would want to work? So I encourage all of you to go and look at your website and ask that question. Is this a place that I would want to work if I were a caregiver looking for work? We know that a lot of applicants in today's job market are coming through the internet. They're coming through Indeed.com as the #1 source, according to Home Care Pulse. Local job sites, My CNA Jobs has penetrated the industry, and a lot of companies have worked with My CNA Jobs. I encourage you to look at the benchmarking study to see the data about these various online job boards. Certainly local healthcare job sites, and Craigslist is still around. In spite of all of the challenges that Craigslist has had, they're still out there as a source of digital recruiting applicants. The third and probably the least used strategy of the 3-pronged approach is face-to-face recruiting. It's getting out of the office and going out to meet face-to-face. And of course, during the COVID crisis, we weren't able to do that in the same way. But as we get back to somewhere near reasonable face-to-face meetings, we will see a rebounding of face-to-face recruitings. Our data show that an effective way to do face-to-faces with campus recruiting, and our data show that four-year schools of nursing are an excellent source of high-quality applicants, that nursing students make excellent caregivers while they're going to school. We have to work around their schedules. And we also see that when they graduate from nursing school, they go out to be a nurse, and then they make a great referral source. So campus recruiting, nursing schools, CNA and home health aide training schools. The second on our list is faith-based recruiting. And in our research, we have identified a number of organizations that where the owners of a home care company practice their own faith, and they've connected with their place of worship, their church, their cathedral, their synagogue, their mosque, and they are connecting with potential caregivers through their churches. And we have data that show that a significant number of the best caregivers are also people who worship regularly and who practice their faith. Number 4 on our list here is networking in the community, getting out, meeting centers of influence, meeting people who can refer caregivers to you. And then number 4 is public speaking. And again, there's not much public speaking going on right now because there are very limited gatherings. We are seeing some online Zoom groups and Zoom meetings where we can reach out to a group in a public speaking kind of format. So face-to-face recruiting is a powerful tool, and one that will come back as we open more from the COVID crisis. One of the things that we've learned from our research is that money matters more in recruiting than in retention. We've learned from our research that people don't leave for money, but people will be attracted to a job when the job ad mentions money. It could be pay rate, it could be total annual earnings, it could be benefits that are offered to caregivers that translate to money, insurance programs, paid time off, paid vacation, 401k, and retirement plans. But what we realize is that the message that we communicate in our recruiting ads is going to be different than the message we send to our current caregivers as it relates to retention. And we're doing a lot more research onto this, and we'll have more information to share with you. One of the things that we know about turnover, and we learned this from the benchmarking study from Home Care Pulse, is that over 80% of turnover happens in the first 90 days. And so we've been working with our mastermind groups to understand 90-day turnover and retention. And what we've discovered is that there are 3 key elements to improving 90-day retention. The first element is to do a better job of selection to begin with. Because if you hire people who are not a good fit for caregiving and are not a good fit for your company, they will leave. So do a better job of selection at the beginning. Number 2 is to make sure to keep them working. What we've learned is that if a caregiver comes on to work with you, they are assigned a client, they have a certain number of hours per week. If they lose a client or their hours go down, if you don't build their hours back up, they aren't making enough money to pay the bills, and they will leave to go somewhere else. So it's not about the hourly rate, it's about the total number of hours and the amount in their paycheck at the end of the week. The third big issue is caregiver engagement. And so when you engage your caregivers and help them feel valued and appreciated and connected, they will stay. And if you can keep those caregivers past 90 days, the probability that they will stay for a year goes way up. And if you can keep a caregiver for a year, the probability that they will stay for 3 years goes way up. And that's your core group of best caregivers, the people that have been with you from 1 year to 3 years. And we continue to do research and understand best caregivers and the impact that relates to turnover and retention. And so we're continuing to do research into this, and we're launching a new program actually in October. So we encourage you to stay tuned. A new program called Caregiver Quality Assurance that will be a combination of research, online learning, and caregiver quality mastermind groups, where small groups of companies will come together to share ideas and solve problems around caregiver recruiting and retention. And so if you're interested in being part of this new program, Caregiver Quality Assurance, you can go to caregiverquality.com. You'll see some basic information. You can sign up for our electronic newsletter, and we will let you know when we're ready to roll out Caregiver Quality Assurance. But what we do know is that there are 4 basic elements of Caregiver Quality Assurance. One is the caregiver quality company culture. The culture of your company in creating a great place to work will make all the difference in the world. Second is the caregiver quality recruiting system. Recruiting is a system involving people and processes, and the more that you systematize your recruiting, the more effective it will be. Number 3 is the caregiver quality selection system. And as I said earlier, one of the keys to 90-day retention is doing a better job of selection. And we're doing a lot of research and developing new materials about how to select high quality caregivers. The fourth element is the caregiver quality onboarding system. And we realize that that first day in your office for onboarding and orientation sets the stage for the rest of their career with you. And so having a quality onboarding system is a critical ingredient. And then finally is the caregiver quality retention system. And these are the things that we do to get people through that first 90 days. And then the things that we do to keep them for a year. And then the things that we do to keep them engaged on an ongoing basis so that they believe your company is the best way, the best place to work in your local market. So that leads us to trend number 6, which is data-oriented decision-making. Many of you know me and you've heard me say, what gets measured gets managed, what gets rewarded gets repeated. And so we are seeing more and more companies moving to data-oriented decision-making by tracking their metrics, by using their software for reporting, and by looking at software integration, where your scheduling software integrates with a customer relationship management system and an applicant tracking system. And so, for example, you probably saw this where ClearCare announced an integration with HubSpot, which is an online customer relationship management and marketing tool, and Hierology, which is an online applicant tracking system. And so working with ClearCare, HubSpot, and Hierology, home care companies are able to integrate the systems for scheduling, for sales and marketing, for recruiting and retention. And it's those kinds of things. And so as we look at all of this, and we're coming up to the top of the hour, there are 7 strategic competencies that you can develop to grow your business, to find and keep caregivers, to attract and retain clients. And wish we had another 3 hours to dive in deep into these 7 strategic competencies, but we'll take a moment and just touch on them, and remember that you'll be getting these slides so that you can dig more deeply into this. But number 1 up here is visionarying your company. What do you see your company looking like 5 years from now? Crafting your company culture, making it a great place to work. Creating competitive advantage in your local market, differentiating your home care company from your local competitors. Designing systems for business growth, and designing systems for caregiver recruiting, selection, onboarding, and retention. Developing the knowledge, skills, and values among your leadership team, and then measuring and managing your success. And these are the strategic competencies that we see leaders in the top tier of home care developing, working on. It's a process, it's not an event. It's taking your company from where you are now to where you want to be in the future and building that on a solid foundation. So we've covered lots of information in a short period of time. We're going to stick around for Q&A as long as anyone wants to stay on, but I want to respect those of you who blocked out an hour. If you have to leave, we certainly understand, but if you want to stay, if you want more information on mastermind groups, you can go to homecareceo.com. If you want more information on caregiver quality assurance, you can go to caregiverquality.com. But for right now, we're going to pause and take some more questions. You can type your questions into the question box and Dana will share your questions with us. We'll also stick around to take some voice questions if you want to unmute your voice or your phone and ask a question. So Dana, what do we have in the chat box in the way of questions about any of the things that we've talked about today?
Well, Zach actually had a question. I don't know if you would have the answer to it, but if anybody in the group does, please speak up. Zach said, I heard some rumors that Banner Health is running a pilot program with a non-medical home care company to estimate cost of care versus hospitalizations.
Oh,
is anybody aware of this pilot program existing, or have we heard of any other hospital systems that are doing this?
great question. So this is Banner Health looking at a pilot program partnering with a non-medical home care company.
Yes.
And do we know if it's an independent or a franchise? Do we know any more about it?
No. Zach, do you have any other information aside from what you've heard?
I believe they were a franchise in the Southwest here. I don't know if they're national or not. And it was rumors, so I don't really want to say too much considering it was rumors. I don't have any validation of it, but it did sound like it was specifically looking at the cost of care for either Medicare reimbursements or for the hospitals to be adding some sort of care benefit with that to save money with the hospitalizations.
Right. And that's an excellent point, Zach. And it will not surprise me at all. We've seen some specific examples in other states. I know in Southern California, there's a very large home care company called 24-Hour Home Care, and they have done a really good job of connecting with hospitals and developing relationships and getting referrals from those hospitals and working with the hospitals to reduce readmission rates and also to reduce length of stay so that they can get patients out sooner. So, and Banner Health, of course, is a very forward-thinking, leading home care system in the country, and it would not surprise me at all that they would partner with a company, and it would not surprise me at all that a franchise organization, particularly if there's one that's based there in the Southwest, that would reach out to them for some kind of a partnership. So a great question, great point, Zach. Thanks for sharing that. Dana, do we have some other questions in the queue?
Jamie Fletcher asked, do you know of any home care agencies working with providers to offer CCM/PCM/RPM services paid by Medicare?
Boy, that's a great question. I do not know personally of any of our members working directly with a home health agency. Over the years, I've worked with a number of home health agencies that also have a private pay home care business. And we have seen some examples of where the private pay company and the home health agency collaborate together for the benefit of the patients. I have not worked as closely with home health in the last couple of years, so I am not as familiar with the home health reimbursement model that they're just rolling out, the PDGM. So I don't know the impact of that. Does anybody else in the group or in the room know of any agencies that are working with home health in that regard? If so, unmute yourself and jump in. Okay, great question, Dana. Thank you. Do we have some other questions in the queue?
Stephen, this is Jamie.
Yes, Jamie, go right ahead.
So I was the one who asked that question, and it was actually more for primary care providers and specialists versus home health, because home health currently are not getting reimbursed for those services. However, primary care providers are getting reimbursed for chronic care management and remote patient monitoring, and then as of this year, specialists are getting reimbursed for principal care management and remote patient monitoring.
Okay, very good. Thank you, Jamie. I appreciate that clarification. Now that you've mentioned those acronyms, I'm recalling some information that I have seen on that. Again, I do not know of any home care companies working with primary care physicians or specialists around that, but it would certainly be something interesting to follow. I do know of a home care company in Chicago where the owners are a husband and wife team. The wife runs the home care business. The husband is a physician and a gerontologist. And I know that they have been doing some things together to care for his clients, but I don't know the specifics of that reimbursement model. But thanks, Jamie. Appreciate that, that insight. Dana, do we have some other questions in the queue?
Laura, actually, can you talk a little more about yours since we're an open forum?
Sure. I don't know what I can really say, but it's interesting. We are part of, like, I guess, a pilot program that Medicare provides. I think it's 16 hours of post-discharge attendant care and 40 hours annually of respite care for CareMore members. And it's Advantage members. They have to be a part of that program. So we've been doing that for almost 2 years now. It's been very bumpy because it's new and nobody really knows what they're doing, including, CareMore. So we're kind of working out some kinks. But right now, we, file our claims. I think it's paid through, oh Lord, is it? Oh, I think it's Anthem who's doing the billing this year. That doesn't sound right. I'm not sure that I've said that correctly, but CareMore had their own portal last year and they were paying us and then they bill Medicare. We have to follow certain rules like 4-hour minimums and things like that. And we have a contracted rate with CareMore, we can only provide care. It's 16 hours only of the post-discharge attendant care, and mostly it's housekeeping and maybe some help with personal care and things like that. So it's just it's a little bit loose right now, I guess. And sometimes we struggle with communication. I will say that it's a lot of work for very little hours, but I was interested in being a part of this because I'm hopeful that at some point Medicare will step up and this will become more robust. That's why I wanted to be kind of in it and understand it. It's been very slow pay. I'll say that out loud. But it's not a huge part of our revenue because the hours are so low. So we're able to afford to continue it, but it's a lot of work. I'm not going to lie. If you have to go and do an assessment for 16 hours, that's a lot of work. So right now it's not terribly worth it. We're just keeping our foot in there to see what's coming.
And I applaud you for doing that, Laura. I know it's a lot of work, but it gives you the opportunity to learn about how these plans work, how they think, how they make decisions. And like you, I'm optimistic that at some point in the future, the Medicare program will recognize the value of in-home personal care to make that transition from hospital to home and minimize readmission to the hospital. And so that's a great program. I hope you're keeping some good data. Just another quick question, Laura. You mentioned CareMore. Now, is that a local Medicare Advantage plan?
It is, yes.
And it's affiliated with Anthem Blue Cross Blue Shield?
Gosh, I'm going to have to check on that. I may have misspoken. Hang on. Let me.
Okay. Well, and that's what we see is that there are so many of these local plans, and Anthem has literally hundreds of plans around the country, and each plan has their own various programs. So great. Thank you, Laura, for sharing that. I appreciate it. I hope that was helpful to some others. Dana, do we have some other questions in the queue?
Does anybody else have any other questions? As of right now, that was the last one.
Okay, well, we'll give folks an opportunity to go ahead and type in another question. We'll hang around for a few minutes, but again, thank you, Laura, for sharing that. And again, I hope that you all will stay in touch with your local providers, with your hospitals, with your primary care groups, with your Medicare Advantage plans to learn what they're doing, because there will be a lot more of these demonstration type programs, these pilot test programs at different places around the country. And that's how we sort of keep up with the trends, is doing programs like this and talking with folks like you. We're able to learn about a pilot study like the one Laura mentioned, and then we hear another one and another one, and pretty soon we're able to see what the pattern looks like as we go forward. Well, this has been a great conversation. Dana, any more questions in the chat box?
No, it looks like that's it. Kathy, I'll turn the mic back over to you.
All right, thank you, Dana. Thank you, Kathy. Appreciate being with you all today.
Thank you, Stephen. That was, wow, valuable information for our members. Thank you very much. We already went through the questions, and we'll see those if they come through. So for now, thank you everybody for participating in our third presentation series. Our next one will be Tuesday, October 13th at 11 a.m. You will get information via email, but our speaker will be Tony Brown from the Arizona Corporations Commissions, and she will be speaking on elder abuse, how to identify, address, and train your teams on how to handle these challenging situations. Like I said earlier, email reminders will follow. And last but not least, I will turn over to the AZNHA president, Zach Shaw, for closing remarks.
Thank you, Kathy. And I want to, before I forget, thank Sal Sandata again for sponsoring, and thank Stephen for a great presentation. Always great to have Stephen as a supporter and a presenter for our association down here. So thank you both very much. We have some new news. Recently, members have been a lot more active, sharing feedback, concerns, and general inquiries with us. The increased activity is a good thing. One of our members had even suggested that we hold an open forum session for members to discuss amongst themselves some of the challenges or more pressing issues facing our market and our industry as a whole. We took the suggestion, as we do with every suggestion that comes through, seriously, and then decided that we would provide a platform for members to do just that. So this Friday from noon to 1, AZNHA will hold a members only open discussion Zoom meeting. If there is an active discussion, we will extend that session to 1:30. But in an effort to control the discussion, the general theme of it will revolve around the presentation today from Stephen Tweed. We'd like to ask you to submit any questions or concerns you'd like to discuss ahead of time, as we want to address your questions and your concerns first. You may submit these questions and concerns to info@aznha.org. You guys all should have used that email address in the past. But put the subject line for Friday discussion. That way Linda can organize, get them to me. There won't be a formal presentation on Friday, but I will host and moderate to try to keep us on track and stop us from going off the rails on any other discussions. So please take an opportunity to take advantage of this. It's a great opportunity for us to connect with our fellow members and address some of our concerns, and hopefully learn some things along the way. So again, thank you all of you for your membership and your support. Thank you, Sal. Thank you, Stephen. Thank you, Kathy. Thank you, Linda, Dana, the whole team. And we look forward to seeing you guys Friday and then again next month.
Thank you, everyone. And I'm going to close the meeting now.
Bye, everybody.